Congratulations, you now have braces. This video will teach you how to keep your teeth clean during orthodontic treatment. Today, you have received a kit filled with all the important tools for excellent oral health. First, the interdental brush. This is the most important tool to use during your orthodontic treatment. No matter how much we brush our teeth, the toothbrush alone cannot remove plaque from around the braces. It's really important to use the interdental brush every morning before brushing your teeth, and the same before bed. You may notice that food sometimes gets stuck between the braces. This is the best tool to use for that. To use the interdental brush, be sure to point away from the gums. Scrub the tooth behind the wire, scrub up against the brace, scrub against the tooth. Keep scrubbing the tooth all the way up until the next brace. Go above and around the brace, scrub the brace side behind the wire, scrub the tooth, scrub the tooth, scrub the tooth, all the way to the next brace. And continue with all of the teeth. For the bottom, again, you're pointing away from the gums. Scrub the brace, scrub the tooth, keep scrubbing all the way to the next brace. Now, what if you decide to just brush your teeth with a toothbrush and not use the interdental brush? Let's find out. So after their braces were removed, white marks outlining where the braces were became very evident, leaving the teeth weak and looking chalked. Do you now see the importance of using the interdental brush? This person here decided to do an excellent job brushing. As you can see, there are no white marks on the teeth. The teeth look nice and healthy. Let's move on to our next tool, floss with threaders. Let's watch a demonstration of how to use the floss with threaders. There are two options. If you decide to use the floss threaders, grab about an arm's length of floss, place it through the loop, and now you're ready for flossing. It has a stiff end, so point away from the gums, get behind the wire, floss between the teeth, hug one tooth, up and down, hug the other tooth, up and down, and pull through. For the bottom, you can do the same, pointing away from the gums, get between the teeth, hug one side, up and down, hug the other side, and gently pull through. If you decide to use glide floss, it has two ends, one that is soft and the other that is stiff. Once again, pointing away from the gums, get behind the wire, between the teeth, hug one side, up and over, hug the other side, and gently pull through. For the bottom, pointing away from the gums, so you're going upwards. Get between the teeth, hug one side, hug the other side, and pull through. Be sure to floss your teeth at least once a day. Let's review brushing. Do you use the electric or regular? Studies have shown that when patients use this electric toothbrush, they had less plaque and healthier gums when compared to using a regular toothbrush. Place a pea-sized amount of toothpaste onto the toothbrush. Of course, you want to turn your electric toothbrush on, but for the sake of this video, we'll keep it off. Brush on the biting surfaces of the teeth, back and forth, along the bottom, and on the top. Next, you want to start at the very back of the top teeth. Point at a 90-degree angle and go across each tooth, one by one. Be sure not to use too much pressure so you don't damage your teeth or gums. Of course, do the same for the bottom, all the way across the teeth. After you're done all the outside teeth, be sure to do the tongue sides of the teeth as well, going nice and slow. You want to spend approximately 4 minutes when brushing. Be sure to brush your teeth in the morning, after lunch, and before bed is a must. If you decide to use a manual toothbrush, for instance for a sleepover or if your electric toothbrush is out of battery, once again, place a pea-sized amount of toothpaste onto the bristles. Brush back and forth on the biting surfaces of the teeth. Now for the cheek and lip surfaces of the teeth, sweep away from the gums. So for those top teeth, you want to sweep downwards. For the bottom teeth, you want to sweep upwards. When you're done all the outside surfaces, go to the tongue side and do the same thing, sweeping away from the gums, bottoms and the tops. Also in your kit, you'll notice wax. In the event your braces accidentally pop off a tooth or if a wire breaks, use this wax as a band-aid to cover up any sharp edges. Dry the area with a tissue or cotton. Take some wax, warm it up with your fingers, roll it up into a little ball, and place it onto the sharp area, pressing in gently. When it's time to eat or brush, be sure to remove that wax. When you're done eating and brushing, you can put a fresh new piece of wax right into that area. Please note that braces and wires are very strong and don't just pop off the teeth. It's important to avoid certain habits such as biting on fingernails, picking at your braces, or biting onto hard or sticky foods. You can use Tylenol or Advil to alleviate any discomfort that you feel from your braces. Be sure not to take this medication if you are allergic to it, or if you're under the age of 12 and haven't received parental permission to do this. And now for some review questions. How often should we use the INTERDENTAL brush? That's right, after every meal. How about brushing? How often should we brush? That's right, at least 3 times a day. In the morning, after lunch, and before bed is a must. Be sure to brush at least 4 minutes each time. How often should we floss? It's important to floss at least once a day. Do you have any questions? Be sure to let us know. We hope you enjoyed this video, and thank you for choosing Clearly Orthodontics.